As you know, esophageal cancer is a high burden globally, but for esophageal squamous cell carcinoma, especially for academically, mostly in East Asian part, especially in China, because we know more than 50% of the patients occurred esophageal cancer in China. So we want to do some research for the resectable patients of esophageal cancer ESCC, which kind of a modality of neoadjuvant treatment could be better to the patients. As we all know that chemoradiotherapy is the golden standard right now for the resectable ESCC patients, also for neoadjuvant chemotherapy. But we do now know adding the ICI or immunotherapy is better or not. So that is the science clinical trial. We want to do 3 arms of comparable for the different treatment modalities for ESCC patients. All right, this is I think this is the first phase 3 clinical trial randomized for ESCC, which compared 3 arms. The arm A is the chemo therapy combined immunotherapy, that's sintilimab. Group B is chemoradiotherapy combined immunotherapy, and compared to Group C, the chemoradiotherapy as a golden standard treatment as a control group. That's the methodology. After the neoadjuvant treatment, we will do the surgery, and most of the patients recommend minimally invasive surgery for those patients. And we also combined the ctDNA analysis for this whole clinical trial. It's very interesting. There are 2 principal key findings for this research. Because this is the second interim analysis for this research we reported this time in ASCO meeting. The first is the PCR results, because we have 2 primary endpoints. One is PCR, one is EFS. The EFS will need to wait for the follow-up. And the PCR rate showed the chemoradiotherapy therapy combined with immunotherapy has a very high PCR rate that's nearly 58%. And in Group A, for chemo combined immunotherapy, around 18 to 20% of PCR rate. And in the chemoradiotherapy group, is kind of stable, about 49% of PCR rate compared to the cross trial. So this is the first finding, that is the chemoradiotherapy therapy combined immunotherapy can bring a more higher PCR rate for ESCC patients. The second key point for this finding is the ctDNA. We used 92 patients for ctDNA this time, and in the baseline, we can see nearly 97 to 98% who has the positive of ctDNA for locally advanced ESCC. After the treatment cycle and before the surgery, we can see the trend is very dramatically decreasing for the ctDNA positive based on the treatment, no matter for Group A, B, or C. But very interesting that is in the PCR group and the MPR group, the most of the patients in PCR group, nearly 85%, it is ctDNA negative. So this is very impressive. That showed us the treatment modality combined with the ctDNA can predict those patients in the near future. The purpose of this research, we want to change or give the evidence to the guidelines for esophageal cancer treatment, especially in China and East Asia. So in this clinical trial, we will answer some questions about the treatment modalities in immunotherapy era. Which kind of modalities immunotherapy combined with is more better? After this research, we will give the answer. But the EFS, we still need time to follow up, so maybe 1 or 2 years. We will finish the medium follow-up about the results. And after that, we will publish it, and we will say those treatment modalities will change the EFS or not. But for now, we can say the PCR rate is very impressive based on the chemoradiotherapy combined immunotherapy, and in those patients who is sensitive or who is response very good for the treatment modality, we will have the chance or opportunity to get the organ preservation watch and wait strategy.
Follow me and let's protect your lungs together.